Jones. My name is Lexi. I'm going to be your nurse today. Can you tell me your name and date of birth? She does. And are you allergic to anything? She's not. And I can verify both with her chart. Okay, for privacy. Miss Jones, today you are getting a blood transfusion. I am told that the doctor has been in to talk to you about that. Do you agree with that? She does. And I confirm it with the consent form. Have you had any reactions before to getting a blood transfusion? She is not. If you were to have a reaction, I want you some symptoms maybe. Itchiness, dyspnea, so if you feel any of that, please let me know right away. If she were to start to have these symptoms, we would stop the blood right away. I would disconnect it. I would insert normal saline and flush out the line. I would then do a vitals assessment as well as just a normal assessment, and then we would notify the doctor. If this was a child, we wouldn't give as much blood as we would with someone who's older. So I'm going to go ahead, Miss Jones, and I'm going to check this IV site, making sure that it is still working properly and that you're not infiltrating. So clean that. Again, I'm using normal saline. It is not expired. Perfect. And I don't see any infiltrating, so that looks great. I would have also performed her vitals as well as listening to her lungs. I'll wash my hands again just because I touched my glasses. Blood cannot be out for more than 30 minutes, so as we're waiting before that, I'm going to set up her normal saline. The normal saline is also not expired. There's no holes in the bag. We're using normal saline because it's the only thing that can be mixed with blood. So I'm going to prime that line. If Miss Jones was to have any questions, I would let the doctor know. Make sure those are closed. I am going to spike my bag. I'm going to unlock that and fill this above the filter line. And now, making sure that this stays sterile, I'm going to prime my IV line. Alrighty, I made sure that there is no bubbles in it. I'm making sure it remains sterile. And for just purposes right now, I'm going to have this sitting here. Alrighty. So now I'm ready for the blood. I'm just going to wash my hands and I'm going to call up for the blood. My second nurse, Shaylin, has gotten the blood for me. And I'm going to go through the checks. So Shaylin, my med record is 224466.
Med record is 224466.
The location is the HLRL.
Location HLRL.
Account number 123456.
Account number 123456.
Patient Betty Jones.
Patient's name is Betty Jones.
Red armband 456654.
Red armband 456654.
Patient blood type is B positive.
Patient's blood type is B positive.
Donor pool number is 7890.
Donor pool number 7890.
Units in the pool are 4.
Units in pool 4.
The volume is 250 milliliters.
Volume 250 milliliters.
Blood component is PRBC.
PRBCs is the blood component.
The expiration date and time is 12/22/2020 at 2000.
Expiration date and time 12/22/2020 at 2000.
Donor blood type is O positive.
Donor blood type O positive.
Compatibility test is completed
Compatibility test completed
on the date of 7/6/2020.
on 7/6/2020.
All right, and I'm gonna wash my hands and put on gloves. And now I'm going to assess the bag, making sure there's no blood clots. It's a clear color. The expiration date is in range. Just gonna mix it up. Now I'm ready to swipe it.
First thing I'm going to do is check my patient's order and whether she needs blood, so I'm going to do that in my supplies. I will need blood IV tubing, a bag of normal
I am
saline,
making sure that the normal saline is
alcohol
locked and that the blood is now open. And now I'm going to prime it right up to the blood.
Can you please state your name and date of birth?
Again, making sure and keeping sterile.
So then we're going to provide policy and explain the procedure. So we'll be administering blood, capturing blood cells through your hemoglobin is a little next to your physician's blood order.
And go to the blood, so I'm gonna stop it.
Okay. So
I'm going to keep this sterile,
there's a risk of transfusion reaction. Some signs of that would be
and I'm going to set up the
any
pump.
shortness of breath, any chest pain, feeling fever, strong cold, having itching. So just if you feel any different, just let us know. And then
Make sure the chamber is ready with blood.
informed consent is set.
It is.
And ask her if she has any questions about it.
This is a new patient. We're on the med surg floor. Put in the ID.
The patient is
Channel A. We are going for IV drugs. For B. And we are doing blood. This is correct. Our rate is 15 milliliters. Our bag is 250 milliliters. So I'm going to set it for 225. Before pressing start, I'm assessing the site. Still, there's no infiltration. Everything looks great. I'm going to clean the site.
Check to make sure that my blood is
Put that down.
started infusing within 30 minutes of it arriving. Gonna make sure that
And now we are able to start it.
check my facility policy.
Making sure everything is open. Now, since it is a blood product, I'm going to wait with her for 15 minutes to make sure that we're not seeing any reactions. Remember, Miss Jones, if you're feeling any itching, shortness of breath, so let me know. Per my agency protocol, I will do every 15 to 30 minutes vital sounds and lung sounds. But Miss Jones says she's feeling great, so everything is looking great. When the blood has ran out, I'm going to stop it, and then I'm going to run normal saline all the way through to make sure she gets every last bit of blood. She has no further questions, so I'll put her in a safe spot, hand her her call light. I'm going to take off my gloves, clean up my mess, wash my hands, and I will be done.
And then wash your hands.
Like that. What did I miss?